Everyone, good evening. My name is David Hernandez, Director of Community Services and Parent Resource Centers. Welcome to this evening's webinar dedicated to providing you information concerning oral health. Oral health touches every aspect of our lives, but is often taken for granted. Whether you are 80 or just 8 years old, your oral health is critically important. This webinar is being held simultaneously in two languages, English and Spanish. Ms. Paula Cardenas, PRC Assistant, is providing translation services for this seminar. All Spanish-speaking attendees should press the globe below you or on the bottom of the screen, and it will prompt you to enter a specialized classroom where Ms. Paula will be conducting the translation services. This evening, we have our guest. It's Amrit Sadhu, Health Education Specialist, representing Madera County Health Department. We just thank you for joining us and for addressing this critical role on oral health and how it plays in our daily lives. Also, if you have questions concerning information being shared through the webinar, please use the question and answer feature at the bottom of your screen. Your facilitator will take time at the end of the presentation to address some or all of the questions as time permits. This webinar is being recorded to make the webinar available to others who could not join us this evening. This webinar is also available within 48 hours on the Madera Unified School District website. So um, I believe we are ready. So I would like to reintroduce and thank you so much, Amrit, for joining us and providing this very critical information to our Madera Unified School District parents and the community. Thank you.
Thank you so much for having me. As was explained earlier, my name is Amrit Sidhu. I'm a health education specialist working for the Madera County Department of Public Health, and I work specifically with the local oral health program. And so today I will be going over a little bit about oral health and its relationship to overall health, specifically about how we as parents can take a look at our child's oral health and how we can improve their oral health as it relates to their overall health. So I will continue with the presentation as was mentioned earlier. If you do have any questions, feel free to use the question and answer tab at the top of your screen, and someone will reach out to me and let me know if we have any questions. Otherwise, we will be answering the questions at the end. So this slide here is just an overall slide that describes the mission, vision, and guiding principles of the Madera County Department of Public Health. So I'm just going to skip over this slide. Going over the local oral health program. So what is the local oral health program? It is a part of the Madera County Department of Public Health, where we aim to promote the oral health and well-being of Madera County residents, specifically of children and youth. We do this by assessing the community's needs, providing dental health education, providing linkages to needed resources, and collaborating with community partners. We also provide some direct services, including dental screenings, fluoride varnish application, and we're working on including dental sealants as well. And we are doing this currently through WIC sites, and we are working closely with school sites to provide school-based programs in the future. Overall, we aim to decrease health disparities and make sure that there is more equity, especially in oral health, by increasing access for care, including Medi-Cal recipients, care to the uninsured or the underinsured. And lastly, we also work with policymakers to develop strategies to promote oral health and prevent oral disease. So what is oral health? Oral health is not just the health of the teeth, the gums, it's actually the health of teeth, gums, and the entire oral facial system. So everything that allows us to speak, smile, and chew, and show our emotions. It actually also affects a person's self-esteem, school performance, and attendance at work and school. So good oral health supports an individual's success. For example, family economic security. Adults with good oral health have more job opportunities than their peers that have dental disease. A child with good oral health will do better in school. Kids with dental pain are 4 times more likely to earn lower grades than healthier students. And untreated tooth decay interferes with their ability to learn and attend school every day. Also has to do with cost to states. When good oral health is out of reach for children, these avoidable dental problems then become emergencies, which can lead to costly emergency visits in the future. So what are cavities? Sugar and starch from foods like bread, rice, pasta, soda, and sweets. They mix with the bacteria in your mouth to make an acid. And this is the acid that will make holes in your teeth, known as cavities. So as you can see in the picture, the first enamel decay is the start of a cavity, and it can progress all the way to an infected pulp or the infected nerves on the inside of the gums. We'll also talk about gum disease, which is also known as periodontitis. It's a serious gum infection that damages the soft tissue, and without treatment, it can destroy the bone that supports your teeth. It can cause teeth to loosen, and it can lead to tooth loss. It's common, but it's actually largely preventable. So once again, if you look at this diagram right here, the picture on the most left is the healthy gums and the tooth, versus the picture all the way on the right shows advanced periodontitis, where you can see that the tooth is actually separated from the bone. Tobacco and oral health. There's actually a large, there's a large correlation between tobacco and oral. Cigarettes and chewing tobacco are harmful to your oral health. Smoking and chewing tobacco are known to cause tooth staining, gum disease, tooth loss, and even oral cancer. Oral health and bacteria. I know a lot of these pictures show things that we as parents love to do with our children, but really what we're doing is introducing bacteria into our children's mouths. Bacteria that can cause cavities can be transferred from your mouth to your child's mouth. And baby's teeth, yes, sure, the first set of teeth will fall out, but that bacteria will actually stay around. And it can cause cavities and gum disease when their permanent teeth grow in as well. So we suggest that anytime that, for example, your baby's pacifier falls on the floor, instead of sticking it in our mouth, like I know we normally do to quote unquote clean the pacifier, we actually use water or some sort of cleaning agent to clean it before we give it back to our children. Same with sharing utensils, making sure that we're not sharing utensils, and keeping our mouths as clean as possible. So we're reducing the amount of bacteria that we are introducing to our children. Oral health and overall health. So the health of your mouth, teeth, and gums actually affects the health of your whole body. Oral conditions are frequently considered separate from chronic conditions, but really they're interrelated. For example, dental disease can hurt more than our teeth. It's tied to our overall health. It can lead to diseases such as diabetes and heart disease. Oral disease is also associated with higher risk behaviors, such as using tobacco, as we had mentioned earlier, and also consuming sugary foods and beverages. This dental disease then can harm our heart and lungs. It increases the risk of diabetes, pneumonia, and even our cognitive ability as we age. It can take a toll on our mental health and is one factor leading to depression and low self-confidence. In fact, having a healthy pregnancy includes having good oral health. But untreated dental disease during pregnancy can lead to complications such as preeclampsia, dangerous blood pressure conditions, or even giving birth too soon. And even when our children are born, children with good oral health are better able to eat, sleep, speak, and socialize, which are all key aspects of their healthy development. So what are some good oral hygiene habits? We always recommend brushing your child's teeth with fluoride toothpaste twice a day. For children under 3, we want you to use a rice-size amount of fluoride toothpaste. For children ages 3 to 6, using a pea-sized amount of fluoride toothpaste. After toothbrushing, making sure that we're rinsing the brush and we're storing it upright in a container where it can air dry. So we don't want the toothbrushes to touch each other. And especially if there's anyone in the family that's sick, we want to keep that toothbrush away from everyone else's and replace it once that family member is better. And making sure we're not sharing toothbrushes, because sharing toothbrushes can once again transfer that germs that causes diseases from one person to another. Keeping your teeth and your body strong by eating healthy foods like fruits, vegetables, lean proteins, and drinking water. You can serve your child healthy foods that are low in natural and added sugar. And remember to serve milk or tap water with meals and snacks. And you can give your child a variety of healthy snacks such as cheese and crackers at scheduled times throughout the day. Avoid serving drinks that are high in natural or added sugars such as fruit juice, fruit drinks, and soda. I understand that this is not always possible. So just as a reminder, if you do have your child have some soda or some sugary drinks throughout the day, or even if they get a treat such as a candy bar or something, making sure at the very least they're rinsing out their mouth with water at the end of consuming that meal or that beverage. And then ideally, hopefully that they're brushing their teeth after having that treat. So this is just a graph that shows the difference in price. I understand a common complaint that we get from parents is that dental procedures can be expensive. However, this shows that when we partake in the preventive services, such as fluoride application, having a periodic exam, doing a dental cleaning, or even having dental sealants put on our teeth, we're actually saving money in the long run as opposed to waiting until the last minute when we now need a restorative service, such as having a filling, an extraction, a root canal, or a crown put in. So although these costs can add up, they are a lot less costly than the restorative services that we would have to receive from poor oral health in the end. So I mentioned fluoride varnish. What is fluoride varnish? It's a dental treatment and it can prevent tooth decay. So it's a mineral that can strengthen your tooth's enamel, and it actually fights harmful bacteria on the gums and the teeth. It's applied by being painted on the tops and the sides of the teeth with a small brush. It's sticky when it's first applied, but it hardens once it encounters saliva. It only takes a few minutes to apply, and really it only takes about a minute to apply, even less. And the procedure is completely pain-free. Once the fluoride varnish is applied, you do not brush your teeth or floss your teeth for 4 to 6 hours, and you want to avoid eating or drinking for about 30 minutes. And that's it. And this actually really helps to prevent any sort of tooth decay for children, especially, but for children and adults for the near future. Another preventive service is dental sealants. So dental sealants are also thin coatings that can prevent cavities and tooth decay. But these are more of a protective shield that blocks out germs in food. It's quick, easy, and painless, and it's been proven safe and effective. It's actually also less expensive and easier to apply than a filling. So dental sealants are applied when the tooth is cleaned with a special toothpaste. There is a cleansing liquid that's rubbed gently on the tooth with a piece of cotton and then washed off. The liquid sealant is painted on the tooth, and then the sealant itself hardens in about a minute, and now the sealant is in place. So children should get sealants on their molars, on their back teeth, as soon as they come in. So for example, the first permanent molars come in between the ages of 5 and 7 for most children, and the second permanent molars come in between the ages of 11 and 14. Teenagers and young adults who are prone to decay might also need sealants. And the great thing about sealants is that they protect against 80% of cavities for 2 years and continue to prevent against 50% of cavities for up to 4 years. So they're extremely effective. And based off of the amount of work that they are to apply, they're a great public health intervention. So Medi-Cal Dental. Medi-Cal offers free or low-cost healthcare for eligible California residents, including dental benefits. Dental benefits that are provided through Medi-Cal. You would need your Medi-Cal benefits identification card, and you would take it to your dental provider to receive those dental services. And you do not need to apply separately for Medi-Cal Dental. So if you're currently receiving Medi-Cal benefits, you also have access to Medi-Cal Dental benefits. Medi-Cal is available to all low-income children under 19, regardless of their immigration status. So if your child has health coverage through Medi-Cal or a covered California health plan, he or she also has dental coverage and can go to the dentist for regular checkups and care. You can get the most from your Medi-Cal dental benefits when you see a Medi-Cal dental provider to get covered services, and you go on a regular basis, even if you don't have a problem with your teeth. And you also want to make sure that you're following your Medi-Cal dental provider's advice about dental care. So if they're telling you to brush or floss more often, you want to make sure that you're actually doing those preventive services at home. So for more information about Medi-Cal Dental, you can locate the Smile California website at smilecalifornia.org. Or if you want to locate the Medi-Cal Dental website, it's www.dentic/cal.ca.gov. Finding a dental home. So the concept of a dental home is borrowed from our medical colleagues. It was actually coined in the 1990s when the benefits of regular attendance with a familiar clinician was established. So the main benefits of having a dental home is that you have a trust with the dentist, the receptionist, the nursing staff, and other team members. This is comfortable for you when you're in pain, but it's also to make sure that you're avoiding unnecessary treatment that could have been avoided otherwise, because you're going to have a regular review and a preventive approach to your health. So also having a dental home means that when the unexpected happens, such as a dental injury, trauma, or pain, you know that there's a place that will prioritize your emergency care as a loyal patient. They know you, your history, and your preferences when it comes to dental care. There's also evidence that having an established dental home early in life means that a child will have reduced dental problems over a lifetime. And this actually even has financial benefits as well as a broader positive health effect. So to recap, some of the potential benefits of having a dental home include reduced dental costs over a lifetime, establishing good habits early in life, putting in place preventive measures to reduce the chances of problems arising, and you have access to reliable emergency care if unexpected trauma or pain arises. So this is a very important topic, oral health care during COVID-19. We understand that a lot of people have been nervous to reach out to their dentist or to visit a dentist during the COVID-19 pandemic. So when approaching a dentist, we want to make sure that we're prioritizing the care that was previously postponed, especially for conditions that could potentially lead to dental emergencies if you continue to postpone these treatments. So that would include if you have broken teeth, if you have bleeding in the mouth that doesn't stop, if you have pain and swelling in and around your mouth. Also, if you have maintenance of braces, if you have a recall dental exam that needs to be taken care of, or if you're meant to be having a fluoride fluoride placement. So this being said, there is some dental care that can be rescheduled. So that includes anything that has aerosol generating procedures, such as implants, silver and white fillings, and crowns. If you do need to see a dentist, make sure that you call the office first, tell them about your dental issue, and follow their instructions. There are some changes in the dental office protocol that you can expect. Before going into the dental office, talk with the dental team about the changes that they have put in place to lower the risk of the spread of COVID-19 to the patients and parents. They might call you before the child's visit and ask questions about your health and your child's health, including the oral health. And these questions may be asked again on the day of the visit. There might be a limit on the number of people attending, for example, having only one parent in the office with the child. They may have you call the dental office when you arrive and wait in the car instead of coming into a waiting room in the office. They may be requiring patients and parents to wear a mask while in the building. Upon entering the building, they will be asking the parent and child to check their temperatures. They may restrict care to someone with a fever or if they have any signs of COVID-19, unless the child has severe oral pain or dental injury. In the office, they may be wearing more protective equipment than they used to, so they may have added masks, face shields, and gowns. And they will be disinfecting the room after each patient to lower the risk of spreading COVID-19. The kindergarten oral health assessment. To make sure your child is ready for school, California law requires that your child have a dental checkup by May 31st of their first school year. So that's kindergarten for most children, but if your child did not attend kindergarten, this is then speaking about first grade. Dental evaluations that have happened within 12 months before your child enters school can also meet this requirement. Your school will give you the required form to take with you when your child has their checkup. If you cannot get a dental checkup for your child, you can actually apply for your child to be excused from the requirement by filling out the bottom portion of the form and marking the reasons why your child cannot get the checkup. And if you have any questions specific about the kindergarten oral health assessment or where to find the forms, please feel free to reach out to me or speak in the question and answer portion. I would be happy to help with that. As a recap, to some of the good oral hygiene habits that we talked about today, making sure that we brush our teeth 2 times for 2 minutes each day, floss every day, making sure that we see a dentist 2 times a year, eating healthy foods, which includes limiting sugary foods and sodas, drinking water, and don't smoke or chew tobacco. And that is the presentation. So if anyone has any questions, I'd be happy to help with that.
Okay, you have one question, and that is, what is the best way to clean your toothbrushes? La pregunta es, ¿qué es la mejor manera para limpiar sus cepillos de dientes?
That's a great question. The best way to clean your toothbrush is to just rinse it under hot water and let it air dry. We do want to be sure that we're replacing our toothbrushes regularly, minimally once every 3 months, but once a month if possible. And just making sure that we're not allowing any of the toothbrushes to touch each other. So if we have multiple toothbrushes in the same cup, just making sure that the heads of the toothbrushes aren't touching each other so that we're reducing the risk of exchanging bacteria.
Okay. And let me see. I don't see any additional questions being posted. Is there anything else that we want to talk about? Because you mentioned the importance of seeing the doctor, the dentist, at least twice a year. Is that correct?
Yes, twice a year, especially with our children, because the children's mouth and their teeth are constantly evolving, as you all know. So the more often that we can visit the dentist so that they can get a look inside their mouth and really have a preventive approach to their oral health, the better. Twice a year is the most recommended approach with the American Dental Association right now. However, when we are speaking with our personal dentist, our dental home, they may be able to give you a more personalized answer to that. So if they think that, for example, there's a brown spot on our child's tooth that they want to monitor, and they say maybe you should come in 3 months so we can just keep an eye on that and check on that, make sure it's not turning into a cavity. You always want to take your dentist's advice.
Can you give parents an alternative that they can provide for children when it comes to a beverage? We understand water is the best. We understand that soda is very much better when it's controlled. But is there anything else, some other nutrition value that you can recommend to the parents for a beverage?
Definitely wanting to limit the amount of sugar that's in the beverage and also the amount of acid. What we've seen work really well is any sort of fruit infused waters and making sure that we're creating these beverages with our children so it's exciting for them and they feel like it's a treat. It's something that they've created themselves, but anything with fruit in it, even something that would be tended to be like more of a sugary fruit, we would prefer that over any sort of bottled beverage that came from the store, for example. So I really personally love having watermelon in my water, or even having some limes in my water. Those are all great beverage choices.
Very good. I don't have any more questions. Feel free, if you have any questions, audience, please post them on the question and answer queued right on the bottom of your screen. Padres, si tienen alguna pregunta, por favor de colocar la pregunta en la área donde dice Q y A, or question and answer, para que la señora Sedú nos pueda aconsejar o contestar sus preguntas.
I did mention the kindergarten oral health assessment. So if you don't mind, I would like to go over that a little bit more.
Sure.
So this is actually something that was a requirement introduced into California law starting from 2006. And it's something that the local oral health program here in Madera County is really working hard to educate more school districts about. The purpose of this assessment is so that we have a better snapshot of what the oral health of children in Madera County looks like. And the best way to do that is to get a cross section of certain age group of students. So that's why we picked kindergarten age students. So the assessment itself is really quick and easy. Like I had mentioned earlier, if you have a dental home, have a dental provider, and your child has seen the dental provider in the past 12 months, it's as easy as just going into the dental office, having them sign off of it, and just returning it back to your school. If you don't have a dental provider currently, you have two options. You can either come to one of the public health department's dental days events, which I can speak a little bit about, or you can waive the assessment. So it's not required that your child see a dentist to be able to complete the assessment. It's just required that you fill out the form and give it back to your school. So when I spoke about the dental days events, the public health department puts on dental days events at the WIC clinic. We put them on quite regularly. We used to do it on a monthly basis prior to COVID. Now we're still kind of trying to pivot and figure out what's the best way to do it to maintain social distancing. However, we are still planning on offering this service on an as regular basis as possible. And at that dental days event, we have registered dental hygienists available who do a dental assessment of the child's mouth. They just do a quick toothbrushing. They assess if there's any issues that needs emergency care. And then they also apply fluoride varnish. And so if your child does not have a regular dentist and you want to do the preventive measure, this is also a great option for you. You can always reach out to us and ask us when the next Dental Days event is going to be taking place. Also, you can go to our website and we'll have all of our Dental Days events there as well. And this is a great place for you to have the kindergarten oral health assessment filled out as well.
Very good. Okay, I don't see any additional questions. So I am going to assume that the information was pretty much straightforward. And in the event that you do have questions that pop up after the presentation has completed, feel free to contact your local Madera County Public Health Department. Amrit indicated that she would be available to answer any questions as well. So at this particular point, as we get ready to close this presentation, we do want to thank you, Amrit, for your presentation. I think your presentation certainly created an awareness of information regarding oral health, especially it's critical when we take into consideration that the health of your mouth is very much important and it is linked to many of the health complications. So therefore, I urge all of the listeners that let's put into practice the preventive measures that were introduced this evening. I jotted down just a tad bit of them, to like brushing daily, exercising and walking, doctor visits, at least 2 per year, reduce sugar intake, refrain from smoking or tobacco, and any other thing that you can use to increase your mobility, eat well, balance meals, sleep well. So health is just tied into everything that we do in our daily lives. And certainly we've learned more about how oral health is very critical. So again, I think for our parents here at Madera Unified, we're trying to engage them into more conversations, more information that will help them make those critical decisions as they are raising their children in all the various developmental stages. So we just thank you so much for coming and joining us on this webinar. And this is only the first of many others that will come forward. And thank you so much for the collaboration and our partnership that we have so that we can continue to engage our parents and our audience and our community as much as possible in such critical health information as this one. So thank you so much to everyone who joined us. If you have any questions, always feel free to call. You can even call the call center for Madera Unified School District. I'll give you the number just in case you want to jot it down and you have some questions that pop up. We are more than happy to try to field those questions and get you to the appropriate person. If you have information after the webinar, you can call the Help Center at 416-5879. Again, that number is 416-5879. So thank you once again. Great information, and see you at the next webinar. Thank you.